Sign and symptoms of PCOS. The hormone secreted by the anterior pituitary follicle stimulating hormone and luteinizing hormone. They are on duty to produce estrogen and progesterone in the ovaries. The cells in the follicles they produce estrogen under the influence of follicle stimulating hormone, and this estrogen is responsible for creation of the secondary sex characteristics in the female at puberty. When the conception occurs, then luteinizing hormone produces the progesterone, that is the pregnancy maintaining hormone, by the cells situated in the follicles of the ovaries. But in this syndrome, the production of estrogen and progesterone is suppressed and there is overproduction of androgens because there are a group of cells present in the follicles that produces a small quantity of androgens under the influence of the luteinizing hormone. So when it is produced in excess amount, the female hormones, sex hormones, estrogen, that is decreased, and conception and the menstrual cycle irregularities appears, which are the hallmark in the PCOS. So actually, the reason for the creation of this syndrome is unknown, but it is due to the imbalance of the hormones system. There is overproduction of androgen and the normal or physiological production of estrogen, which is responsible for creation and maintenance of the menstrual cycle, is decreased, and when conception occurs, normally progesterone secretion is increased and the estrogen is lowered. But these two hormones, they are not produced by the cells of the follicles due to defect in the action of the follicle stimulating hormone and the luteinizing hormone, or due to genetic mutation in the cells of the follicles. So due to this, there is falling of the hair, hoarseness of the voice, menstrual irregularity and disturbances, and there is also creation of the female infertility. There is secondary sex characteristics, that is the development of the breast and the various other uh, changes which occur at the puberty in females that doesn't develop properly due to the lack of female sex hormones. Now, the diagnosis is done by the estimation of the hormone quantity or level in the blood. That is the level of the androgens, which is increased, and also the blood counting ESR and the C reactive protein is elevated, and the luteinizing hormone, which is said is responsible for the production of overproduction of the androgen, is also elevated. To study the histology of the ovary in this syndrome, we perform pelvic sonography. There is polycystic syndrome, or the follicles are seen in the surface of over the surface of the ovary. So this is a sac which is filled with liquid and immature ovum. So in this syndrome, the either the production of the ovum is decreased or it is an ovulation stage, because the immature ovum are present in the follicles filled with the liquid. And these are said the appearance of the cysts over the enlarged and swollen ovaries. Next, we perform vaginal sonography. That is the internal sonography, by means of which we observe the changes in the uterus. Due to this syndrome, there is endometrial hyperplasia leading to uterine cancer and cervical cancers. So these are the various diagnostic process we adopt to detect the presence of polycystic ovarian syndrome. There is hoarseness of the voice, there is irregularity of the menstrual cycle, and there is an ovulation leading to the female infertility. So these are the main disturbances created by this pathology and syndrome.